Recorded Medication Teaching, an initiative of the Manitoba ACS Network and St. Boniface Hospital. Nitroglycerin. Fast-acting nitroglycerin widens the heart arteries to prevent or treat heart pain, also known as angina. Angina feels different for each person, but may involve any of the following: tightness, pressure, aching, or other discomfort in the chest, aching or discomfort in the shoulders, arms, neck, jaw, or upper back, shortness of breath or difficulty breathing, sweating or feeling clammy, or feelings of nausea and sometimes vomiting. Fast-acting nitroglycerin may be used by people with stable blockages in the heart arteries that cause angina, or by people who have had a heart attack and may be at risk of further heart pain and heart attacks. Fast-acting nitroglycerin may be provided as a spray or as tablets. If you have been prescribed fast-acting nitroglycerin and have chest pain or other discomfort that may be due to your heart, stop whatever you are doing and sit down. Follow these 4 steps to use your nitroglycerin. Step 1. If your nitroglycerin is a spray, prime the spray by spraying into the air as directed if the bottle is new or has not been used for several days or more. This will clear air bubbles from the pump so that you will get the full dose. Step 2. Give 1 spray or place 1 tablet of nitroglycerin under your tongue and leave it there. Do not chew or swallow the tablet or inhale or swallow the spray. Nitroglycerin will absorb directly into your blood from under your tongue. Wait 5 minutes to get the full effect of the dose. Step 3. If the pain or discomfort is not relieved after 5 minutes, repeat the dose. Wait another 5 minutes. Step 4. If the pain or discomfort continues after 2 doses and 10 minutes, you may be having a heart attack. Use a 3rd dose and immediately call your local emergency number to take you to the nearest hospital. Do not drive yourself and do not delay. Some people may be instructed to use fast-acting nitroglycerin when they are active or exercise. If you have been told by your healthcare provider to use nitroglycerin before exercising, use it 5 to 10 minutes before starting. Make sure you carry your fast-acting nitroglycerin with you when you go out, and make sure family members know where it is stored at home. If you forget or lose your nitroglycerin, it can be purchased at any pharmacy without a prescription by asking for it at the pharmacy counter. Do not store your nitroglycerin in your car or in another place that may get very hot or very cold. Nitroglycerin may not work if it has gotten too hot or too cold. Your nitroglycerin should be stored in a cool, dry place, not in the bathroom or on top of the refrigerator. If you have nitroglycerin tablets, keep them in their original glass bottle. If you want to remove some tablets from this bottle, use only bottles made for nitroglycerin tablets and throw away these tablets after 3 months. Because nitroglycerin tablets have extra handling and storage requirements, some people find it easier to use nitroglycerin spray rather than tablets. However, if you have trouble pushing the button on the spray bottle, you may prefer to use the tablets. The main side effects of nitroglycerin are headache and dizziness. Headache and dizziness are common after using fast-acting nitroglycerin, but will only last a short while. It's also normal for nitroglycerin tablets to cause a mild tingling or burning sensation under the tongue. Nitroglycerin interacts with sildenafil, also known as Viagra or Revatio, tadalafil, also known as Cialis or Adcirca, and vardenafil, also known as Levitra. Do not use nitroglycerin for 24 hours after taking sildenafil or vardenafil, and do not use it for 48 hours after taking tadalafil. Talk to your pharmacist or other healthcare provider for more information. If you have any questions, talk to your pharmacist or other healthcare provider. Visit the Manitoba ACS Network website at www.mbacsnetwork.ca